مش شغال ولا ايه؟ Okay. Good afternoon. I am reham abdelhamid. I will be presenting interesting case about pediatrics. Our case is a 1-year-old male patient who had a history of evacuation of extradural hemorrhage outside. Then he developed similar symptoms and admitted to our hospital suspecting recurrence. CT brain was done, which shows multiple extra-axial, extra-osseous soft tissue masses, but the bone shows heron and appearance and speculated pattern. The first image, this is the pre-contrast. These masses show post-contrast enhancement. Here, the sagittal and coronal cuts showing these masses. Where these masses involving the sutural lines, we can see sutural diastasis. PAN-CT was requested for searching for the primary, suspecting neuroblastoma. First, we checked the suprarenals, which were free. Then, when we checked the other cuts, we can see left isodense soft tissue mass, which elevates the left common iliac artery. This is the typical site of the organ of Zucker-Kendall, where it is the site of the primary the neuroblastoma. Contrast-enhanced MRI was requested and shows these masses exhibiting through diffusion restriction. T1 and T2 sequences show intermediate signal of these masses, and vivid contrast enhancement in the axial and coronal post-contrast enhancement. The diagnosis is a case of metastatic craniocerebral neuroblastoma. So, what's our differential diagnosis? First, the extraaxial intracranial hemorrhages. First, the extradural hemorrhages, we should check the bone window, searching for underlying discal fascial fracture, and the other image is subdural hemorrhage. In our differential dural-based masses, the image on the left side showing meningioma and on the right showing primary dural lymphoma. Actually, it's difficult to differentiate between the meningioma and primary dural lymphoma, as they share multiple similarities. We can think as well of Ewing sarcoma myths. Let's take home message. Don't rush for the diagnosis of extradural hemorrhage before proper assessment of the bone window for osteolytic lesions, for the possibility of tumor or mets. Thank you.
Thank you, Reham.